Hi, everyone. I'm Dr. Seth Meyers, clinical psychologist, and today I'm going to talk a little bit about avoidant personality. This is a personality type that is often not talked about. A lot of times you'll hear in the media a lot of conversation about some of the better known personality disorders, like borderline personality disorder or narcissistic personality disorder. But there is another personality disorder called avoidant personality disorder that can cause significant problems in close relationships. So, I'm going to talk a little bit about avoidant personality today. Now, first, before I do, just a quick note that, of course, one may have the full blown avoidant personality disorder and meet certain criteria to have that diagnosis. A diagnosis, of course, can only be made by a mental health professional. A lot of times, some of these symptoms exist on a spectrum. So, while some individuals may meet the full criteria for the diagnosis of avoidant personality disorder, many individuals will simply show some of the symptoms. And I'll talk about those now. If an individual has avoidant personality, that is characterized by a pervasive pattern of social inhibition. Another factor is feelings of inadequacy. And finally, there's hypersensitivity to negative judgments. Some of the specific characteristics and symptoms of an individual with avoidant personality disorder include avoiding occupational activities that involve significant interpersonal interaction. And specifically, that is out of fear or anxiety around criticism, disapproval, or rejection. The individual may be unwilling to get involved with certain people unless they can be certain that they will be liked. Restraint in close, intimate relationships out of fear of being criticized or shamed. The individual is inhibited in new social situations out of fears of inadequacy. The individual views themselves as socially inept or personally unappealing. The individual is unusually reluctant to take risks or to try new activities out of fear that they will end up being embarrassed. Avoidant personality and these specific symptoms are described in greater detail in the Diagnostic and Statistical Manual of Mental Disorders, but it's important that you have a just general understanding of the symptoms that make the foundation of avoidant personality. Now, what we're going to focus on today is the impact of avoidant personality on relationships. So, an individual who has avoidant personality can really have really impaired interpersonal relationships because close relationships often require being vulnerable, talking about feelings, compromise, and working through emotions. Individuals in close, intimate relationships can often end up feeling exhausted and kind of emotionally drained by the experience. They have developed a life approach that is often based on self reliance. They have come to see that they meet their own physical and emotional needs, whatever needs that they may have. And so they live their life according to this sort of self reliant code. It's not even so much that this is what they choose. This is simply who they believe they are and how they operate. The person with avoidant personality can often feel uncomfortable and even come to resent the other person for relying on them to meet emotional needs. Because remember, the individual with avoidant personality, they operate from the perspective of I meet my primary physical and emotional needs, whatever emotional needs I have. So it makes perfect sense if someone with avoidant personality doesn't want the person they're in a relationship to ask them to do something that they don't ask the other to do for them. Some research, I think, could be extremely helpful for you to really understand the root of avoidant personality. Tatkin in 2009 wrote that the individual with avoidant personality may say something along these lines: I want you in my house, just not in my room unless I ask you. What's important about that is that the individual with avoidant personality may want some relationship, but a relationship that is not too close, because a relationship for an avoidant personality that is too close could feel, and just try to guess for a moment what that may feel like. It may feel confining. It may feel overwhelming. They may feel like they're being sort of pushed up against the wall. They're being forced to be someone that they're not, to feel things that they don't. When we think about close interpersonal relationships, we often understand that close relationships sometimes require navigating feelings, working through problems, compromising, listening, and really trying to understand better how the other person is feeling. What's important for anyone in relationship with someone who has avoidant personality to understand is there is almost zero interest in working through feelings. It is simply not exactly a language, an emotional language that this individual speaks. The avoidant personality does not think along deep interpersonal emotional lines. It's also important to understand that someone who has avoidant personality often may not even understand exactly the feelings that they are experiencing. They may not have a lot of self awareness in terms of understanding and taking their own emotional temperature to figure out, what is this feeling? Is it sadness, or is it more disappointment? Is it anger? Is it more resentment? So an individual with avoidant personality, you have to understand, avoids, wants to push away this sort of examination, this sort of exploration of an interior emotional life. So, what happens when someone with avoidant personality is in a situation where they do start to feel some negative feelings towards someone else, or their partner tends to ask them to confront and deal with some negative emotions in the relationship? The avoidant personality in these situations will usually retreat. They will usually shut down and engage in what is called clinically distancing behavior. They will make every effort to distance themselves physically and emotionally from all of the emotional content. So, an avoidant personality tends to think of feelings and emotions just in general as messy, amorphous, confusing, frustrating, even annoying, but most of all, draining and not something that they want to do. Examples of some of the distancing behavior that they may engage in: they may avoid any kind of physical contact, even from holding hands. They may refrain from wanting hugs, or certainly any sexual activity, any kind of physical closeness, they may distance themselves from. They may avoid deep conversation for fear that conversation, and really conversation of any kind, might ultimately lead back to conflict or discussing the emotional issues, which again is simply not something that they are comfortable really ever doing. They may isolate themselves in a particular area of the house or the shared apartment if they live with someone. If they are outside of the home, they may try to go to areas where they can physically be away from others. They may refuse to discuss or make any future commitments. They may resist declarations of positive feelings like, I love you. Again, it's emotional content, and they will avoid that too, especially when there are uncomfortable issues or tensions afoot. They may resist listening to their partner in a particular situation. They may resist validating them or letting them know that they understand how their partner feels. Again, they want to avoid it. If forced to walk with their partner, for example, they may engage in behaviors where they may walk ahead or behind of their partner so they don't actually walk together. Another thing that avoidant personalities may do to distance themselves in a relationship is to engage in addictive behaviors. to escape the emotional complexity of an interpersonal relationship. And they may engage in addictive behaviors in the form of gambling addictions or sex addictions or excessive pornography use. These are just some of the examples in addition to substance use. What does it feel like to be someone who is in a relationship with someone who has avoidant personality? We talked a little bit about what it feels like for the individual who is avoidant themselves, but what about for the person who's in a relationship with someone with avoidant personality? It can be very confusing to be in a relationship with someone who has avoidant personality. One of the things they might find themselves doing is going on a kind of mission to try to figure out what it is that is causing this person to act this way. There is so much information and education in the media about narcissism, for example. So, an individual who's in a relationship with a narcissist may be able to easily find things online that can help them understand what this relationship is like and try to give them advice and solutions about what they need to do moving forward. But if you're in a relationship with someone who has avoidant personality, you probably spend years or at least months trying to figure out, why does this person act that way? Is it me? Do they not really want a relationship with me? Would they be happier with someone else? Do they not want emotional intimacy? Do they not want closeness? Why don't they seem to want a sexual relationship? Are they not attracted to me? It is a series of questions that you may find yourself asking if you're in a relationship with someone with avoidant personality. And unfortunately, there aren't always a lot of good answers. There's not a lot of information about avoidant personality. And that's really one of the things that I wanted to do in making this video, is to shed some light on it and really speak to those who are in relationships with people with avoidant personality and let them know that yes, there is hope for you, that you can serve yourself well, to kind of understand what some of these symptoms are, that there is a label for it, and that that label is avoidant. I know that sometimes people will feel that labels aren't actually very helpful, that diagnoses aren't always necessary. But the truth is that a lot of times a label or a diagnosis can be very helpful, not just to someone who is suffering from a disorder or from some of those symptoms, but also for the people around those people. So, if you are in a relationship with someone who has avoidant personality, it can be very, very helpful for you to understand what this label means, what it looks like, and also how some of the people in close relationship with avoidant personalities can end up feeling. What happens really until the individual starts to get better educated about avoidant personality is that they often take it personally. But once you start to learn about what avoidant personality is and what it looks like in another person, you can start to understand that that detachment from you, that the other person's detached way of being, what feels like it's apathy or disinterest or not even liking or caring sometimes about you and your feelings, that's actually not necessarily true. That it may not be so conscious. It may not be their attempt to make you feel this way. That it may actually be a function of avoidant personality and their total avoidance of wanting to deal with the messiness of close relationships. So, in summary, when we talk about the avoidant personality, it's important to understand the overarching orientation of avoidant personality is self reliance. To avoid any true dependence on another person and to function as autonomously as possible in life. It's important to note that not only do they not want to depend too much on you emotionally, but they also feel very uncomfortable with you depending too much on them emotionally. The chief motivation and self protective defense mechanism for the avoidant person is to avoid too much closeness. One way to think about it is like this: the deal is that we coexist, but we run our own separate shows. as we coexist together? Here is a question that I know many individuals will wonder, and I have been asked before in my work as a psychologist. Can anyone have a good relationship with someone who has avoidant personality? So the answer is it depends. If you are looking for a relationship or you are already in a relationship, ask yourself this basic question. How much closeness, how much emotional closeness do you want in a relationship? If you are someone who wants a lot of emotional closeness, who wants to not only spend a lot of time together, but also really wants to share a lot of interests and hobbies, and when things come up or frustrations and wants to talk them out and work through them, and is really good at listening to others and compromising and being sensitive to others, then this is a relationship with an avoidant personality that may not be satisfying for you. If you're in a relationship with someone who doesn't really want closeness, you can end up feeling really frustrated and unsatisfied. On the other hand, if you are someone who prizes your own independence, who likes to be in a relationship but doesn't necessarily need a lot of emotional closeness, doesn't necessarily need to talk a lot about feelings or work through a lot, really looks for a partner who is very independent and really can have a kind of successful coexistence without too much closeness, then you could have a relationship with someone that could be fairly workable, even if they have avoidant personality. Also, on the other side of this, if you are someone who has avoidant personality, the same logic applies. It's very important, I think, to convey with people in the beginning. Let me tell you about the kind of relationship that I'm looking for. Let me tell you about some of the traits that I have, some of the kind of closeness that I am looking for in my life, examples of closeness that feels good, and examples of too much closeness that wouldn't feel good. Be honest with that. Try to communicate about that from the very beginning, and that can really help you figure out who could be a good match for you. If you're already in a relationship with someone and there are tensions, one of the best things that you can do is to talk to a mental health professional who can help you work through some of these issues. Now, one great resource is SAMHSA.gov, SAMHSA, has a great find help resource that can really help direct you to all sorts of services that could be helpful. I hope this has helped. And if this has been helpful, please like this video so that I have a sense of what you find helpful.